More and more of my practice has gone to minimally invasive and less invasive techniques, which unfortunately do require extended use of fluoro and image intensifiers. By the age of 48, I had cataracts in both eyes, which needed to be replaced, secondary, I'm sure, to my radiation. 7 years ago, I was diagnosed with AML, acute myelogenous leukemia. The only risk factor that I had was all of the radiation that I procure in the operating suite or in the diagnostic suites. So the ill effects of radiation are numerous, and my personal history is living proof that we should all, in the medical world as well as everywhere else, be hypervigilant about radiation, its potential ill effects, and how we can avoid them. It's a large staff that it takes to pull off a spine surgery. I have the satisfaction of knowing, or at least thinking, that I'm trying to do my best in every aspect of protecting their health and their lives. And ControlRad has been a huge proponent of that quest of mine. When a technique or a technology will change the way that healthcare is provided, that medicine is performed, it is disruptive technology. In this case, it's all totally on the plus side of disruption. And on most of those cases, I average about 64 to 65% less radiation. And with the gating technology and principles utilized in this technique on this machine, we can also narrow the beam, limit the scatter, focus the beams, and I get better images. So there's no downside to utilizing the ControlRad technology, and that's really the big hit for those of us that are rushing between cases. You're trying to get from one to the other. Maybe you forget your leaded glasses. You forget to put your hat back on. You say, I don't have time to get into another set of lead-based gloves. Having a much decreased source of radiation and maintaining the visuality and the image that we need to do our work satisfactorily is a huge hit.